Hi, welcome back. I'm Dwayne with Valley Rehab Physical Therapy. Today we're going to be talking about general neck pain. There are a lot of different reasons to have neck pain. So to keep it simple, today I'm just going to be talking about a general neck pain. It could be you slept funny and you just woke up and your neck is a little pinchy. There's a sharp pain. It could also be just a general achiness, whether you're, work from a computer or you work from home and you're constantly on a laptop and maybe your setup's not just right. So we're just going to talk about general neck pain. Some things to think about the general neck pain are the red flags. And if you are having any of these red flags, I would suggest you consult your physician. Some general red flags are going to be numbness and tingling in your fingertips, nausea, dizziness. When you stand up from a chair, you just pass out and you fall. Some other things are going to be positional tolerances. When I go into different positions, I could feel burning, searing pain that's shooting in different places of my body. So some of those things are going to be the red flags. If you're dealing with any of those, I want you to consult with your physician. A lot of neck pain is actually caused by other places rather than just our neck. So a lot of the musculature from our neck goes down and attaches elsewhere. So that being said, we're going to focus a little bit on those muscles. So some of those muscles can get tight when we're talking about, a lot of our posture, if we're on the computer. And if you feel like that is your problem, check out our channel. Go back and look at our postural assessment for the computer and the desk use, because that will also help and compound with some of these exercises that I'm going to show you next. A lot of people who have neck pain have a lot of tightness through the chest muscles through here. So this exercise, we're going to use a foam roller here. And you can get one of these, at your sporting goods store or on Amazon. We're just going to use that to help stretch out the chest muscles to allow some of the neck muscles to relax a little bit more. So we're going to start laying on the foam roller here. And a good position is when your head is on the roller, but also your butt is on the roller, so we're not putting extra stress. The roller is laying straight along your spine. So if it's shifted to one side more than the other, you want to scoot it over so it's directly in the center. Okay? The legs are bent here to prevent you from rolling off the roller. Okay? So we're going to start, our hands are interlaced here, and then we're just relaxing and letting the shoulders fall with gravity. Okay? If you're not feeling the stretch here, you can actively squeeze the shoulder blades back and together to feel a little bit more of a stretch. I recommend staying in this position for 2 to 5 minutes. If you're just resting, if you're squeezing and holding, I recommend 30 seconds to 60 seconds, okay? There is another stretch here where we're gonna put our arms straight like this, and that will stretch a different region of our chest muscle. Again, you can stay here 2 to 5 minutes, or you can squeeze down extra for 30 to 60 seconds. Then we're gonna move our hands out toward our sides here, and then try to let our hands rest on the table. Again, 30 to 60 seconds if we're squeezing, 2 to 5 minutes if we're just relaxing. One thing to note with this exercise, if you're getting pinching in the shoulder joint here, we want to avoid that. So this exercise isn't an option for you, and the other two options will be appropriate. These next two exercises are to stretch the side of your neck here or your upper trap, and then the back side of the neck here, which is your levator scap. Okay, so you're gonna start and you're gonna sit on your hand like this, and then you're gonna sit up as tall as you can, and that's gonna sort of pull the shoulder blade down and keep it down like that. Then you're gonna go opposite of the shoulder that you're sitting on. And you should feel the stretch on the side here, okay? If you actively pull like this and you don't feel a stretch, it is okay to use the other hand to give yourself a little bit of overpressure here. Just a light to moderate stretch. I recommend 30 to 60 seconds. And then we're gonna do the other stretch, and then you're gonna turn away from the arm you're sitting on, and then you're gonna look down like that, and you'll feel this stretch. Instead of being on the side here, you'll feel it a little bit more on the back side, and it'll go up toward the base of your skull. Again, if you don't feel that much of a stretch and you wanna put a little bit of overpressure that is appropriate, you're gonna hold this for 30 to 60 seconds as well. And we're gonna do both sides. This exercise here is to help stretch out and move the upper back here. When the upper back gets really stiff, it stops our neck from being able to function like it normally should. So we're gonna start on the wall here, and we're gonna face the wall. Our fingers are gonna be interlaced on the backside of our head, and then we're gonna pull our elbows together. Okay, we're gonna lean our elbows and touch the wall with our elbows. Then we're gonna glide our elbows up the wall, and we should feel a stretch here. Our core needs to be braced. If we're not bracing with our core, what's gonna happen is our hips are gonna dive toward the wall like this, and you're gonna feel some strain in your lower back. So it's really important to keep our hips back, keep our core engaged, and we're gonna slide up the wall, and we're gonna brace for a few seconds. We're gonna feel that stretch and mobilize, and then we're gonna slowly bring that back down. I recommend to do this for about 10 to 15 repetitions, nice and slow. Thanks for watching this video. Please like, subscribe, share, or drop a comment. Stay tuned for the next video.